Perforator Flap in Oral Maxillofacial and Head and Neck Reconstruction, edited by Yue He, was published in 2025 by Springer Nature Singapore and Shanghai Jiao Tong University Press. It belongs to the fields of oral and maxillofacial surgery, reconstructive microsurgery, and head and neck surgery. No single target audience is formally defined, but the content is clearly aimed at oral and maxillofacial surgeons, head and neck surgeons, and residents in surgical specialties. The fundamental idea is that successful reconstruction means more than simply closing a defect and achieving flap survival. It also requires preservation of function and appearance while minimizing donor site morbidity. Perforator flaps are presented as a means of achieving more precise reconstruction with less damage to the donor site. The book contains 15 chapters. The first 4 address the development of the concept, anatomy, and microsurgical vascular principles. The 5th and 6th cover preoperative perforator mapping. Chapters 7 through 12 focus on the harvesting and application of different flaps. And the final 3 chapters are devoted to anesthesia, perioperative management, monitoring, and postoperative care. The structure logically follows the clinical pathway from planning to postoperative follow-up. The scientific foundation is solid but uneven. Some chapters cite systematic reviews and meta-analyses, including recent studies on microvascular anastomoses and flap comparisons, while many technical recommendations are based on anatomical studies, case series, retrospective analyses, and the author's experience. I did not find randomized controlled trials in the document serving as a direct basis for the recommendations. This is not unexpected in reconstructive microsurgery, but a preferred flap does not automatically represent a recommendation supported by the highest level of evidence. The book does not formally grade the evidence, so the reader must distinguish between findings from a systematic review and the experience of a single center. A good example of self-critical interpretation is found in the discussion of the superficial circumflex iliac artery perforator flap. The authors report very high success rates but acknowledge that these are probably influenced by operator experience and strict patient selection. One of the most important clinical messages is the principle of maximizing the benefit-to-harm ratio. Flap selection should take into account the size, shape, and depth of the defect, dead space, sensory and motor function, the condition of recipient vessels, the quality of donor tissue, the patient's general condition, and individual needs. The donor site therefore becomes part of the overall outcome. Another important recommendation concerns preoperative perforator mapping. The authors show that vascular anatomy varies and that Doppler ultrasonography, computed tomographic angiography, and magnetic resonance angiography can help in selecting perforators and designing the flap. They describe the limitations of handheld Doppler in assessing depth, vessel caliber, and course and warn against basing the plan in critically on this method alone. However, some of the radiology chapters rely primarily on literature published up to approximately 2014 and 2015, while providing very specific scanning and contrast parameters. Because imaging equipment has evolved, such details should not be accepted as universal contemporary protocols without checking local standards. Based on the available sources, this cannot be reliably assessed. A third important recommendation concerns flap selection. The anterolateral thigh perforator flap is presented as a versatile option for large and complex defects because of its long vascular pedicle, variety of tissue components, and relatively low donor site morbidity. The authors nevertheless state that it may be too bulky for smaller defects, particularly in obese patients, and caution against its use in patients with lower extremity vascular disease, previous deep vein thrombosis, or a vascular stent. The superficial circumflex iliac artery perforator flap is recommended for medium-sized defects and when a concealed donor site is important, but the small vessel caliber, microsurgical complexity, and limited tissue volume reduce its applicability in large complex defects. The management of complications is particularly useful. The book describes the first 3 postoperative days as the period of greatest risk for vascular crisis and recommends intensive monitoring of color, temperature, capillary refill, swelling, and bleeding, with rapid intervention when arterial or venous compromise is suspected. The chapter on anticoagulant therapy reasonably presents both the benefits and the risks of low molecular weight heparin, dextran, and acetylsalicylic acid, while clearly stating that no uniform standard medication regimen has been established in microsurgery. Therefore, specific doses and pharmacologic regimens should not be interpreted as universal guidelines. For general dental practice, the value of the book is limited, but for reconstructive surgeons it provides practical assistance in donor site selection, pedicle planning, assessment of feasibility, and early detection of complications. Communication with the patient is not a central theme, although the book appropriately emphasizes the need to explain possible contour changes, scarring, and donor site consequences in advance. The major strengths of the book are very specific. The first is the integration of anatomy, radiology, microsurgery, anesthesia, and postoperative care into a single treatment pathway. The second is the consistent inclusion of donor site morbidity in reconstructive decision-making. The third is its strong visual component. Operative photographs and diagrams illustrate flap design, perforator dissection, flap transfer, donor site closure, and postoperative outcomes. One case involving a buccal defect follows the procedure from resection to the 1-year intraoral and aesthetic result. The fourth strength is that the authors frequently describe contraindications, technical pitfalls, and limitations. The fifth is the very recent literature in some of the later chapters, including papers published in 2024 and 2025. The weaknesses are equally clear. The greatest is the uneven level of evidence. The second is the uneven currency of the references. Some radiologic and technical chapters rely on considerably older literature than the perioperative chapters. The third is that precise pharmacologic regimens, thresholds, and timing protocols sometimes sound like universal rules despite the absence of formal evidence grading. The fourth weakness is insufficient harmonization of recommendations. One chapter specifies absolute bed rest for 72 hours and ambulation on the 5th to 7th postoperative day, while elsewhere mobilization as early as the first postoperative day is recommended for a particular flap. Different patients and different flaps may justify different protocols, but the book does not provide an algorithm explaining these differences. The fifth weakness is the absence of a unified matrix directly comparing flaps according to defect size, tissue volume, pedicle length, donor site morbidity, and strength of evidence. For dental students, this is not a basic textbook. It is too specialized, although it may serve as useful supplementary reading for those interested in oral surgery and oncology. For younger dentists and general practitioners, its value lies mainly in understanding the treatment pathway after major resections. Residents and specialists in oral and maxillofacial surgery, head and neck surgery, and reconstructive microsurgery are likely to benefit the most, while faculty members may use it as an anatomical and operative reference. The three most important professional concepts are that flap survival alone is not sufficient if the functional or donor site cost is too high, that preoperative vascular mapping should support rather than replace anatomical knowledge and surgical judgment, and that early recognition of vascular compromise is an integral part of successful reconstruction. When I refer to the level of evidence, I am referring to the sources cited by the book itself. I did not conduct an independent systematic search of the external literature, and therefore I do not present the author's claims as independently confirmed facts. Does the book deserve a place in a professional library? For a reconstructive oral and maxillofacial surgeon, yes. For a general dentist, it is not a priority. Its greatest value lies in combining detailed anatomy, operative technique, and extensive clinical iconography, while its greatest weakness is the uneven strength of evidence and the lack of a unified algorithm for flap selection and perioperative management. It is best regarded as a specialized surgical textbook and operative reference manual rather than as a clinical guideline. If the question is whether it is worth the time required to read it, the answer is yes for a colleague who is seriously involved in head and neck reconstruction. provided that the operative recommendations are critically compared with contemporary local protocols and the individual needs of each patient.